So let's talk about a very, very sensitive subject with a lot of dentists, which is who's running your dental office. Now, all of my dental colleagues out there want to believe, and rightfully so, that they're in charge of running their dental office. Let me tell you, with all the offices that I've consulted for, most of the time, and I mean most of the time, over 70% of the time, the dentist is not running the dental office. So what does that mean? Very often there's going to be a alpha type person working at the front desk who by de facto becomes the office manager who starts to decide on policy. So how could they do that? So this is the kind of thing that bothers me as a dentist and as a small business owner when I consult these offices and I see these dentists who have spent hundreds of thousands of dollars in their education and hundreds of thousands of dollars in their dental office, and then they relinquish control of their dental office to somebody who may be well-intentioned, doesn't have the academic credentials to manage this million-dollar business that you've actually worked so hard to get. So let's talk about some of the examples. Let's start with, to me, the cornerstone of any really good dental office, which is hygiene. So what's the most important thing that a hygienist should do? Hygienists should probe every patient every single time they come in for a recare visit. I can't tell you the number of offices that I consult for where the dental hygienist says, I'm not going to probe every single pocket every single time. I'm just going to spot probe. I'm going to spot probe 6 places in the patient's mouth, and from there I'm going to make a decision whether or not they have periodontal disease. I've never heard anything so crazy. When you go to the medical office, you don't have the nurse or the lady at the front desk telling the medical doctor what test you're going to have that particular day or what screening procedure you're going to go through on that particular day. So who sets the periodontal policy, the hygiene policy inside the dental office? It's you, the doctor, not the hygienist. The hygienist has no say-so in whether or not you're going to probe 6 spots or the entire patient's mouth. So let's talk about best practices. If you were the patient, what would you want done? You want your entire mouth probed because in order to treat gingivitis or periodontitis, if you catch it early, you can treat it non-surgically. That just makes sense. Why do you want to wait until it's a 7 or 8 millimeter pocket with all kinds of pus and blood and all kinds of terrible stuff coming out of that little hole before you treat it? It just doesn't make sense. So who sets the policy? You do. You're the doctor. What if the hygienist says, no, I'm not going to go ahead and probe every single pocket every single time? It's time to find a new hygienist. The hygienist works for you. You don't work for the hygienist. There's an expression I love to use, which is the tail doesn't wag the dog. So don't allow these people to dictate clinical policy. What are some of the other examples? Well, how often do you take radiographs? Do you take a full set of radiographs every single year or every 3 years? Do you take a pano every single year, every 3 years? Well, if you're in orthodontic practice, you're probably taking a pano every single year. And why is that? Because you know that's the best practices. So one of the groups that I consult for is an orthodontic group, and we had to work together with the doctors to set policy. I don't set the policy because I'm not an orthodontist. What I do is I try to help doctors navigate through policy setting procedures, and then it gets implemented inside the office. But here's the hard part. It's the implementation inside the office that usually stymies most dental practices because the doctors start to get a little bit of pushback. And what do the doctors do? And the excuses that I hear from them all the time, and it drives me crazy when I hear it. It's like, well, she's been my dental assistant for 15 years. She's very loyal. She shows up all the time. The hygienist has been there for 12 years. The patients love her, and the patients love her, and I'm afraid that if we lose her, the patients are going to leave. And, you know, Carol's been at the front desk for 20 years, and she knows how to work the insurance, and she collects most of the money. I don't really want to upset the apple cart here. It's your business. You spend hundreds of thousands of dollars in your education, hundreds of thousands of dollars building your dental practice. It's your reputation. It's your license on the line. If anybody other than you is setting the office policy, then you are not running your business. So what do you need to do? You need to get control of this. And if the people that are working for you decide not to listen to you, it's time to find somebody who will listen to you. It's your office. So what's the hardest part about this thing? Which is really sitting down and deciding on the policies that you as a practitioner want to set. Which is, what are the standards that you feel are so important in order to give your patients the best dentistry and the best treatment possible? Once you decide that, then you're going to tell everybody who works for you, this is what's going to be done. So let's talk about some other businesses outside of dentistry and find out whether or not this is the case. So do you think the airplane pilot who sits behind the cockpit and he's ready to take off in this big 747 jet gets to decide the checklist and the order of the checklist in order to fly that plane? No, he doesn't get to decide that. That pilot has to follow a set of rules that have been crafted by the airline company in order to fly that plane. Do you think somebody who's driving a bus gets to decide to change the route in the morning in order to pick up people in a different order? Or does the bus driver drive a particular route? What about the person who repairs your car? There's a set of orders or there's a set of circumstances that person's going to follow in order to fix your car. Why would you let the people who work for you dictate clinical policy and decide on their own what is best for your patients when it's your money and it's your reputation and it's your dental license on the line? So how do you get started on this whole entire thing? Well, let's go through it again. You got to set policy, and you've got to start to implement policy. If you try and do it all at once, it becomes a little bit overwhelming to the people that are working for you. So what you're going to do is you're going to sit down with everyone and say, I, as the doctor, the owner of this business, the owner of this dental practice, the guy whose license is on the wall, I'm going to start to set some policy. We're going to start to change things, the way we do things in this office. And if you don't like it, then perhaps it's best that you go someplace else, because all of this stuff is going to happen in the next 30 to 60 days. And you're going to find out very quickly that they respect that leadership. They want leadership. They want a set of parameters in order for them to follow and to make you happy and to make the patients happy. There will be some pushback because somebody's been doing the same job for the last 20 years, and this is the way we've always done it. I'm not going to change. Those people have no place in your business because your business always has to be evolving to become better and better. So what do I need you to do? I need you to set policies. I need you to institute the policies, create deadlines for these policies. And for those people who work for you who decide not to want to integrate all of these policies, it's time for them to go because you need to grow and you need to help your patients. I know it's a very, very complicated subject, and sometimes you just need somebody to talk to. And I'm more than happy to talk to you, and I don't charge you for this. So if you want to talk about policies and how you implement these things and what do you do with pushback from your employees and so forth, give me a call. My phone number is 954-683-2693. Yes, that's my cell number. You get to talk to me. I'm not going to charge you anything. I just love being a dentist, and I want to help other dentists do better in their practices. Because the idea that somebody other than you is running your practice drives a guy like me crazy, and it can't happen. You cannot allow other people to dictate the type of dentist that you thought you were going to be and you know that you can be kind of going forward. Thanks a lot.